Thank you, Mr. Chairman. And I want to thank our witnesses for appearing before the subcommittee as well. They both have distinguished careers and can offer some important insights on the hearing about responding to our nation's economic crisis, which is today's topic. But with due respect, Mr. Chairman, both of today's witnesses were selected by the majority. And I know you and I spoke about this, but I requested, as Rule 11 of the House of Representatives actually requires, that the minority get to also have a witness so that the select committee can hear from a diversity of perspectives. You know, whether people are from different parties, if they're both bringing a similar perspective on an issue, that's not the intention of the House rules, which is why I asked for a witness as well, and somebody who is widely regarded as an expert on the economy. He's testified before Congress dozens of times. In fact, he was a former head of the Congressional Budget Office. He is the person tasked to inform us, Congress, on understanding budget and economic impacts of policy decisions. So, Mr. Chairman, I know you denied that witness. We talked about it. But because of that decision, we're also being denied the diversity of opinion that we should be getting on today's topic. We should all request and seek that the House rules, as they require, welcome that diversity of opinion, which is why both parties are allowed to invite witnesses to provide us with pertinent testimony. That was denied today to us at this hearing, unfortunately, and it hinders our ability to get all of the facts. But with that, Mr. Chairman, pursuant to Clause 2J1 of Rule 11, I'm requesting that we get what we're allowed under the rules, and that is a minority day of hearing under this subject. The rules require it. They were not followed in the request that we made. It doesn't allow the chair to select both a Republican and Democrat. It allows the chair to select witnesses, but it also allows the minority to be able to submit a witness. We did that. It was denied. So in lieu of that, the rules require that we are able to have a minority day of hearing. I just wanted to invoke that, Mr. Chairman. I know you and I can, our staffs can work through that. But as a point of order, I did want to bring that up, Mr. Chairman. Why don't we now talk about the state of the economy? The unemployment rate, yep, Mr. Chairman,
you for a moment.
On that point of order.
Well, thank you very much. I understand that you have submitted a letter. I have received the letter, and I will take it under advisement. I will commit to you today that I will consider your request in accordance with the House rules. In fact, as I understand it, that one of the witnesses that you have requested already appeared before this committee just last month. With that, I would yield back and thank you, and I'm sure that you and I will be able to deal with this in an amicable manner.
Thank you, Mr. Chairman. I'm confident we'll be able to work through this as well. Now, why don't we talk about the economy? The unemployment rate in February was 3.5%. That's the lowest in over 50 years. The unemployment rate for African Americans and Hispanics was the lowest in recorded history of this country. Hourly wages were growing at the fastest pace we've seen in over a decade. America was experiencing the hottest economy we've ever seen, and every segment of our country was reaping those benefits. And then a global pandemic hit our shores. China lied and hid the truth about it. The organization that the world looks to for medical expertise and guidance in a pandemic, the World Health Organization, was corruptly complicit in actually regurgitating China's lies. America got hit hard, and it got hit fast, like the rest of the world did in this global pandemic, the worst we've seen in over 100 years. Immediately, America came together to fight the invisible enemy and to prevent our hospitals from being overwhelmed. And we did so without knowing nearly as much as we do today by this unique destructive virus. All we could really do was shut down and put the largest, most prosperous economy in human history on pause. The pause was necessary, but it came at a staggering cost. From the lowest unemployment in 50 years to now over 40 million jobs lost. Income inequality was made worse. 40% of people making less than $40,000 were laid off. Children lost irretrievable months of in-school learning. Vaccinations plummeted. Progress on the opioid crisis that we made working together was reversed. What America must now decide is whether those losses are going to be short-term costs or will they be long-term irrevocable damage. I proudly supported the CARES Act. In fact, virtually all members of Congress did. And there are some important structural building blocks for recovery in that legislation. We already know about PPP, and we've had hearings on the tremendous success that did in saving millions of jobs. But we put billions of dollars in place for PPE to protect our frontline healthcare workers. We put billions in place for testing, for the development of therapies, and ultimately a vaccine. But let's be honest about the relief portions of the CARES Act. What we did was float the U.S. economy with borrowed money to temporarily compensate for shutting it down. The question before us today is, knowing now what we know about the unintended costs of the shutdown, do we continue to extend it or instead focus on the building blocks of long-term, sustainable, and equitable recovery? A few key principles and shared goals should guide us in this direction. Federal policy should reward and support America's workers. Educating our children safely in the classroom is a paramount responsibility. It's not just a goal, it's something we have to achieve. Federal policy should accelerate innovation and research and manufacturing here in the United States. And only a healthy and growing economy can support long-term, sustainable, and equitable prosperity. With that, all Americans are concerned about the continued spread of the virus, and all Americans have a role and a responsibility in helping to slow the spread, as we're all wearing masks when we're out in public. But let's also acknowledge some key developments. The death rate continues to fall because we're doing better protecting our most vulnerable populations and improving the treatment of COVID patients. President Trump's Operation Warp Speed is showing great promise, including this week's remarkable announcement of promising results from vaccine trials. Testing capacity and PPE production continue to ramp up. Red tape is being cut, and this progress can give hope to all of us who want to end this pandemic. America must continue to forge ahead with this can-do attitude and find practical solutions to the challenges that must be solved, beginning with safely reopening our schools. Earlier this week, Vice President Pence brought his task force down to Louisiana, and I had the honor of spending the day with them, along with our governor, who happens to be a Democrat, talking with school officials, public health experts, and even Coach Ogeron about the importance of getting kids back to school and how to do it safely. Dr. Birx, by the way, who's the White House coordinator, coronavirus response coordinator, and a respected medical official, was there and talking about how you can safely reopen. Our attitude has to be how to do it, not whether you can do it. Clearly, it can be done. Children need to get back to school and continue their education. For many children, the time lost will never be made up. Children's health will improve if schools reopen. Vaccinations will increase. Child nutrition for our most vulnerable will improve. The American Academy of Pediatrics, Mr. Chairman, issued an important report which, among other things, quote, strongly advocates that all policy considerations for the coming school year should start with a goal of having students physically present. The report goes on to say, quote, the importance of in-person learning is well documented, and there's already evidence of the negative impacts on children because of school closures in the spring. I would hope that we would be focused on the damage to students of not reopening as we put our efforts behind how to safely reopen. Mr. Chairman, I'd like to ask unanimous consent that this report by the American Academy of Pediatrics be entered into the record, if there's any objection, but I did want to make that request. But just to
reserve the right to object, though I do not intend to object.
Sorry, wrong page.
We'll provide you with this report by the Academy of Pediatrics, and I would ask that it be included if there's no objection.
Without objection.
To conclude, Mr. Chairman, thank you. School reopening also helps restore a healthy economy because parents can more readily get back to work. We should resolve that no business in America ever again have to compete with a federal policy that makes unemployment relief pay better than actually going back to work. Small business after small business has told me their biggest obstacle reopening right now is getting their workers to come back because the temporary bonus unemployment check in many cases pays more than the actual salary. This policy needs to stop. While some in Washington want to continue the shutdown with the federal government continue floating the economy and have the Federal Reserve just keep printing more money, That is not a path to prosperity. We have faced big challenges throughout America's history. America put a man on a moon. For goodness sake, we can surely reopen our schools and safely rebuild our economy. Let's rise to this challenge. I yield back the balance of my time, Mr. Chairman.